Well, CPR is known for saving lives, but it can also double or triple a person's chance of survival. Here to explain CPR and its significance is Bobby DiMarco with Manning Family Childrens. Good morning.
Good morning. Thank you for having me.
Thank you for joining us today. And really, it's a really great time to talk about this, especially in the warmer months. We have pool season, also a lot of outdoor activities. So why is it important for anyone really to learn CPR, even if you're not a medical professional?
As you said, CPR saves lives. Most cardiac arrest or people who need CPR, according to American Heart Association, are outside of the hospital setting. More than 350,000 people need CPR each year outside of a hospital, and 23,000 of those people are actually pediatric population. And so it's very important for the bystander. There's only a 10% survival rate when CPR is not started early.
So let's talk about some of the warning signs. How do you recognize when is that point someone should jump in and give CPR?
So if someone has pain in the shoulder, up the jaw, in the back, women are different than men in some of their signs and symptoms. But the most classic is you find someone who's unconscious and unresponsive. Quick action will save lives.
Right.
It can double or triple the survival rate if started early.
All right. Well, we often see those examples of adults getting CPR, but why is it so important for parents and caregivers to learn child-specific CPR?
So children usually have healthy hearts. So it's an accident or an injury. As you said, during the summer months, they're at camp, they're summer activities. So people around them need to learn how to help. Choking, things like that would all be included in a CPR. We offer CPR classes at Manning Family Childrens for parents and caregivers, and it is a non-certification class.
Okay.
So it's a hands-on practice while watching video. We teach infants to children. Soon we will implement an adult CPR hands-only for adults, just for the community.
So I guess touching on that a little bit more, what are some of the differences in the technique? Is there a difference in technique if you're giving CPR for an adult versus a child versus an infant?
So people don't like to breathe on people.
Okay.
So American Heart and Red Cross came up with hands-only CPR for adults. So pushing hard and fast is the most important part of any CPR maneuver. So that maneuver has helped people feel more comfortable, and even imperfect CPR is better than no CPR.
Right.
With children and infants, the breathing is more important because theirs is more of a breathing issue or some other accident or injury that causes them to need CPR. And so with children is much like the adult. 2 inches in depth, we're going to push hard and fast at a rate of 100 to 120 compressions in a minute. And then infants are a little different. Anyone under the age of 1 is considered an infant. And so we would use different hand technique, either the hands encircling technique or 2-finger technique. And the compressions are 1.5 inches versus 2 inches on adults and children.
Okay. Well, thank you so much for giving us this information today. Really quickly, if someone wants to take one of these classes, how can they find out more information?
Yes, so they can contact the Parenting Center at Manning Family Childrens. We actually have a class scheduled June 26th, and every Thursday of the month we usually have a class.
All right. Well, thank you so much for joining us.
Thank you.